Hi guys, Dr. Nora here. Now this weekend I am at none other than the Non-Surgical Symposium over here in Sydney at the International Convention Centre. Just touched down in Sydney Airport and it's freezing here. Whew. I'm feeling confident. Yeah, I've got this. I'm doing this for you guys. I'm going to show you how we rock it down at Dr. Nora's clinic. Yeah. Yes, that's right. I'm going to be presenting inside that building over there.
Our next speaker is Nora.
Good morning everyone and welcome. Thanks for coming. My name is Dr. Nora. I'm a cosmetic doctor, a general practitioner and non-surgical trainer, which means that I teach delegates around Australia nationwide how to perform safe cosmetic injectables. But before I tell you what the technology is, let's talk about why we need it. As you can see over on the left-hand side there, the picture, it's not great. It's not in the center. It's far away. Comparing it to the right side, it's better, but it's not perfect. And of course, we know that if you present your patient with a bad photo, they're not going to be happy. They're going to say to you, oh, why does my face look a bit different? Why does it look odd? What happened to all that work that you've done? And they're going to look at your picture, look back in the mirror, and it's just not going to look right for them. But not only that, we're all cosmetic practitioners. We rely heavily on marketing. To the patients, if you don't have a social media account, you don't exist. They can't find you. They won't be able to see what your work is like. If we do this, it does take time. As you know, it does take time to edit your pictures. And I don't know, did anybody here go to the anatomical workshop a couple of days ago? For the rest of you, I'll fill you in. One of the lecturers said that to generate the perfect photo can take up to an hour. Now, I don't know about you, but I don't have enough time in my clinic to take a picture and spend an hour looking at it. And so I present to you today an application called Treatment Pad. Treatment Pad uses artificial intelligence to lay out your pictures. It uses artificial intelligence to help you take the perfect picture. It uses artificial intelligence to help categorize your patient database. Now I know what you're all thinking, that's a lot of intelligence, right? Is there anything left for us? Well, don't worry, it doesn't actually know how to do injectables just yet, so we've still got our job safe. So to demonstrate the layout function, I'm just going to play you a short video that I've made. And just like that, with a click of a button, the pictures are automatically laid out together. Now let's get technical. It uses computer vision and machine learning to analyze the photos to detect facial markers such as the eyes, the nose and the mouth. And then with this, instantly, it can analyse the pictures and put them side by side together, giving you a perfect before and after photo. But I hear you asking, is it accurate? Well, this is a live demonstration of it working with my patients. As you can see, it's lining up the patient's pictures together. However, it won't correct a bad picture. As you can appreciate, over here on the right side, the picture is distorted. So this is a picture that's suffering from a bit of facial distortion. And as you can see, the way that you hold the camera will change the face of your patient as well. So for example, over on the right side, the camera was held quite low, making my nose look quite big and my nostrils apparent. Whereas on the left side, I'd say it's a good central picture. So what if we use this technology in real time to help us take that best picture? So here I am in Sydney, just by the Darling Harbour, and you can see that this is real time. It's tracking my face. It's getting those facial points, it's getting my eyes, my nose, and as the camera is moving around, it's still detecting me. So it's telling me when to take the best picture. And if I move it too high or too low, the markers are still there on place. If you'd like to find out more, head over to treatmentpad.com. Thank you very much for listening.
Vaginal treatment between.
Now, I have to say I was a little bit nervous, but I got through it and I did really well. And I know that because the Q&As, there were so many questions. People were asking me, when is it getting released? How much does it cost? And somebody even offered me funding. Oh my God, amazing. And what's more better than that was that one of the moderators was like, hey, do you want a business partner? So it was such an awesome experience presenting over here at this beautiful location. And now it's time to get inside and get learning some more anatomy of the face to keep you guys safe when I'm injecting. See you on the inside. zoom into the pictures and you can see like it lines up the nose.
So they line this before and after.
Exactly, yeah.
This.
This is a fantastic opportunity for cosmetic physicians, doctors, plastic surgeons to come together, hear the latest and greatest in advancing technologies in the cosmetic scenes. And the best thing about it is you get to network with your colleagues, your friends that you might have seen on Instagram, and even plastic surgeons that you may not even have the chance to talk to previously. Are you enjoying the conference so far?
So much, yes.
What have you learned?
Lots of lower face jawline. Lots of jawline today, and really excited to try out some different techniques.
Beautiful. What is your favourite cosmetic injectable area that you like doing, Alia?
Lips and jawline, for sure.
Yeah?
Yeah,
Do you
what
like
about you?
I like lips as well.
You like lips?
Big lips.
Yeah.
Alia, for all of our viewers out there, where can they check you out? Where is your clinic located?
So I work at Immersion Clinical Spa in Melbourne. So I work in the city in 55 Exhibition Street. So you can check me out there.
Instagram handle?
Yes, at Dr. Alia Yusuf.
Thank you so much, Dr.
Thank
Alia. Beautiful. And Jake, tell us a little bit about which is your favourite procedure to do on your patients?
Well, I guess I'm best known for sort of multi-syringe, full-face type treatments. So, when the client comes looking at lines and wrinkles, wanting these smaller things addressed, we tend to take a more of a holistic approach and look at the whole face.
Now, the symposium itself is comprised of a series of lectures in the morning and through the afternoon, and also it's got a great exhibition hall where you can actually even test out, yes, that is right, test out the devices. Now, I myself, usually, I don't really volunteer for these things because I get a little bit scared. However, this weekend I braved up. And you know what, guys? I tested out the non-surgical butt lift for you. That is right. Kim Kardashian, eat your heart out. I was there, I was on the table, and I had a 30-minute treatment session for an electromagnetic treatment which helps to stimulate muscles. It's ticklish. Yeah, it's just ticklish. It's funny. Yeah. I can feel the muscles contracting. So I've just completed my treatment on my buttocks, which is a non-surgical butt job, which is what all girls want, right? But when you first have it, it gives you like this weird sensation, like it's prickling your skin and it feels like you're getting these electrical firings. But then after about 10-15 minutes, it just feels like a massage almost. It's exciting. This could be the way forward. Brazilian butt lifts have a really high mortality rate because sometimes the fat can go into an embolism and it can create things like death. So if there's a non-surgical technique that does the same thing with less risk, then this is definitely the way forward.
So it's actually putting in the hairs from a preloaded cartridge into what is known as the most common implant site for men, which is the frontal area.
The frontal, yeah.
So that means it's already finished doing the harvest, which is in the back area of your head.
Yeah.
And the harvests have been processed by your team, made sure that everything is viable, looks good. If you've got 4 hairs in a graft, you split that graft to be able to implant 2 hairs instead of just 1.
Wow.
And then the machine does the implantation for you.
It's amazing.
So it's in the past, doctors would do all that manually. With a pen or the robot saves that and allows these doctors to just push that business all the way to further than it ever has been before. Yeah.
And you know what? It gets even better than I know. I'm giving you gold nuggets right now, but because I went around and I spoke to every single exhibitionist, that is right, every single person in the exhibition hall, I got my very own branded non-surgical Symposium, International Convention Sydney, might I add. What do you think it is? Umbrella, that is right. For those days when it rains in Australia, I can just whip it out. And they say there's bad luck to open an umbrella, but you know, I'm gonna do it for you guys, for my viewers out there. There we have it. Hello and welcome. So that wraps up the non-surgical symposium from 2019 over here at the International Convention Centre in Sydney, and I can say I've had an awesome time.